Dr. Sajid here, talking about some different issue this time totally. We consider our home a very safe place. This is where we spend most of the time, day and night. But I want to point out that this can be a dangerous place for little babies and little children. So if you have a baby at home, and especially when he or she starts crawling and starts walking, then it is only natural that the baby will explore, and this is the only way the baby learns, is by touching and by exploring. So it is our responsibility to make our house as child-proof as possible. Now, the first thing I would tell you is the electrical outlets and the electrical appliances. So these should be plugged or covered, or they should be at a height where a child cannot reach. Similarly, lamps and other electrical appliances that have cords or electrical cords that can be pulled by a child, you have to take care of to make sure the baby doesn't get hurt. So electrocution and also strangulation because of this, or injury, because sometimes they can even pull down a television by its cord if it's unstable. So please be careful. The other very important aspect is medicines. Now we keep a lot of medicines at home, some that have been prescribed to ourselves, our parents, grandparents, relatives, or even to the child. And sometimes we keep some normal, as we call them, medicines at home for fever, for stomach upset, for discomfort of any kind. So these medicines should be kept at a place where the child cannot reach. And remember, a child can use a stool or a chair to reach a lot of places that you cannot imagine. So it should be in a child-proof cabinet, and also maybe locked. And keep a list of medicines that you have at home, so in case the baby takes them accidentally, you know exactly what medicine may have been taken. Now similarly, cleaning agents and supplies are invariably kept very low, sometimes under the sink, in the lower cabinets where a child can reach very easily, and accidents will and do occur. Also, you never do put one chemical into a bottle of a cold drink or juice, so that a child thinks that it may be something to drink and may actually ingest a chemical. Water is a lot of fun for babies. Bathing time, whether it be in the shower or in the tub, is a lot of fun, but make sure that you don't have the water very hot. And if you are bathing the baby, please stay with the baby, because the babies these little infants and children can turn the hot water on, and this can cause burns on the skin. Similarly, you have to be very careful when you're having hot tea or hot coffee. Sometimes the baby will come running, and before you know it, it has caused burn. This is one of the commonest causes of burns in children. The floor must be such that if you're cleaning it, it's not slippery, so that a child who keeps running in the house may take a fall. Similarly, furniture should be such that it doesn't have sharp margins or does not have a lot of glass. Sometimes you keep decoration pieces that a child can hold or break and get hurt. I'd also warn you about plastic bags, or shoppers as we call them here. They can be causes of suffocating injuries. They will sometimes put their head in that particular shopping bag and can get suffocated. So you have to be very careful. You either keep them where they can't reach them, or you not use them at all. Kitchen is another area where children can follow the mother. So if you're not using the oven, or if you are there, you should latch it, lock it, so that a child cannot open the door. Similarly, burners should be a little out of range of children, and I've already told you about hot water, coffee and tea. You should also be very careful about knives and scissors, and if you keep them in drawers, you should not keep them in places where a child can access it. So please put them in areas where a child cannot reach, or they are locked, or they are at a height where it's not possible for the child to be able to reach them. The last two items on my list are smoking. So smoke in general, and smoking cigarettes is a no-no in the presence of children. Smoking is harmful to the person, and it is just as harmful if the child is getting what we call passive smoke. We have indoor plants, and so you shouldn't have plants that have thorns. You shouldn't have plants with a lot of soil. You shouldn't have plants with pots that can be displaced, or where a child can accidentally get hurt. And of course, make sure that you don't put fertilizers and chemicals on these plants of a nature where a child can pick them up and ingest them. So with a few precautions, you can make your child stay at home and be comfortable. But if you're not careful, the house can become a very dangerous place for a curious and growing child.